Our group project is on Alzheimer's disease, prepared by Mackenzie Stowe, Ashley Blunt, Leanne Blackwelder, Olga Martinez, and Lindsay Collins.
Symptoms that are associated with this disease. Alzheimer's disease slowly unravels the mind, beginning with simple memory slips like forgetting names, misplacing items, or even repeating stories. As it progresses, confusion sets in. People may lose track of time and get lost in familiar places, or they may even struggle with everyday conversations. Emotions can shift unexpectedly, bringing frustration, anxiety, or even sadness. In its later stages, even recognizing loved ones or caring for oneself becomes very difficult. It's not just a loss of memory, it's a gradual fading of identity, deeply affecting both the individual and everyone who loves them.
Hi, my name is Mackenzie Stowe, and this is one of two of my slides. I had causative factors of Alzheimer's disease and the physiological mechanisms of Alzheimer's on this slide. So, Alzheimer's disease is commonly thought to be caused by something going wrong in the brain. However, based on current scientific research, lifestyle, environment, living conditions, and a person's genetics are a leading known cause for Alzheimer's disease. The physiological mechanisms of Alzheimer's are various. There are multiple physiological mechanisms in Alzheimer's disease. It all depends on what stage of Alzheimer's disease a person is at. During stages 1 and 2, there is evidence of pathological biomarkers, but no symptoms are shown. In stage 3, mild cognitive symptoms appear, such as mild impairment or MCI, but they don't yet interfere with a person's daily activities like waking up, standing, walking, toileting, such as those. In stage 4, the mental symptoms start to interfere with a person's daily activities, which include walking, standing, making their own food, etc. During stage 5, a person's behavior may change and it may become more difficult to accomplish daily activities, and they may need assistance from an HHA or a home health aide. Lastly, in stage 6, a person's physical health is affected, and most of the time they're either put in a nursing home or have an HHA or home health aide helping them because it is now a necessity. Hi, this is Mackenzie Stowe, and this is my second slide, and this slide is about the affected organs and organ systems. Now, the affected organ in the body is the brain. Alzheimer's can affect the brain in many different ways, but as Alzheimer's disease progresses, the brain cells die and don't work correctly. As this continues, the cells in the brain can't communicate properly with one another. The cells are damaged by toxins such as alcohol or infections can be the leading cause of memory loss in Alzheimer's patients. Not only that, but when there is a lack of oxygen in the brain for long periods, it can cause damage to the brain and even lead to the death of hundreds of thousands of cells. Now, the nervous system is the affected organ system. Alzheimer's affects not only the brain cells, but also your memory and thinking skills, and eventually, a person's ability to perform the simplest tasks. Not only does it affect a person's memory, but it can affect their mood and behaviors. Before Alzheimer's disease, a person may be able to do all sorts of everyday tasks, such as walking, making food, using the restroom, etc. And their mood and personality and behaviors will be all of their own doing. However, after Alzheimer's disease affects the brain and the nervous system, a person may find it challenging to do some of their regular day to day tasks and even experience slight or even significant changes in their behavior, where a person might be very quiet or soft spoken before Alzheimer's, and when the Alzheimer's appears, they can become combative or very aggressive.
Is this disease preventable or treatable? No, there is no cure for Alzheimer's disease, but there are treatments that can help manage symptoms and potentially slow down its progression. These treatments include medication and also non drug options. There have been some studies that suggest that good lifestyle factors like a healthy diet and exercise can potentially reduce the risk of developing Alzheimer's disease. Treatments for Alzheimer's disease. Some treatments may be with using medications. Certain medications can help manage symptoms like memory loss and confusion. Other medications may also help slow down the progression of the disease. Another option is non drug options. These can include therapies like cognitive training, physical activities, and dietary changes like eating healthier meals.
Ways Alzheimer's disease is diagnosed. Although it may be difficult to diagnose, here are several different ways to diagnose this disease. According to an academic journal, Alzheimer's disease is first signaled by mild cognitive impairment. A way to diagnose Alzheimer's disease is by a cognitive function assessment. This assessment allows doctors to assess the patient's memory loss, language skills, and thinking ability. Similar to cognitive assessment, doctors can do a behavioral assessment. This assessment will help doctors assess the patient's mood swings, change in personality over time, and disorientation. In 2019, my grandfather actually passed away from Alzheimer's disease, and the doctors were able to use both the cognitive and behavioral assessment to help diagnose him with this disease. Another way to diagnose Alzheimer's disease is by brain images, such as an MRI or CT scan. On the bottom of the slide is an example of an MRI where the brain may appear to have shrinkage compared to a healthy brain. Finally, this disease can be diagnosed by lab testing, which includes blood testing.
How many individuals are affected by this disease? It is said that almost 7 million people are affected by Alzheimer's in the United States. According to the Aging and Alzheimer's Disease Pathology, the number of people with dementia worldwide is predicted to increase to 131.5 million by the year 2050. Alzheimer's usually affects individuals around the age of 65 and older. Early onset can begin for some people in their 30s, 40s, and 50s. Around two-thirds of individuals with Alzheimer's are women in the United States.